The basic cardiac exam starts with taking a blood pressure. Please see the blood pressure video. And then also inspecting the neck and actually auscultating the carotids. We've palpated the carotids previously with our pulse video, but now you're going to actually auscultate, and you're auscultating for bruits, which is turbulent blood flow from a narrowing of a vessel. You're going to palpate the carotid. You're going to place the bell of the stethoscope over the carotid artery. Ask your patient to take a deep breath and hold it. And then listen. You should not hear anything, and then you may release. Then you have to do it on the other side as well. Locate the carotid. Place the bell of the stethoscope. Ask your patient to take a deep breath and hold it. And breathe. The cardiac exam has several steps involved. The first one is inspection. It's important to make sure that you're able to see the whole precordium so that you can inspect it properly. For inspection, you should lay the table down or have the table flat and have your patient lie down. With preserving some modesty, you do want to, though, be able to expose the chest so that you can see it. Now, what you're looking for is obviously the heart sits right here, and if a patient does have a bra on or something that's covering it, it's going to have to be lifted. So you can certainly ask your patient to help you in lifting the area. So if you could hold this up like this. And right here is where you're looking. This is in the fifth intercostal space. The midclavicular line is typically where the point of maximal impulse is located. And in this area, you should get eye level with your patient's chest, and you're looking for abnormal movements, thrusts, lifts, or heaves. So during inspection, this is what you're looking in this area for. So you have to have it exposed so that you're able to see it. If the bra strap is down like this, of course I can't see anything and I can't comment on it. Okay? And it's absolutely fine to ask your patient to help you out by holding things so that you feel more comfortable. During palpation, you're palpating the point of maximal impulse. Using this portion of your hand actually tends to be more sensitive than your fingertips. So you're going to place your hand in this area around the point of maximal impulse to see if you're able to feel it. Typically, the point of maximal impulse should be somewhere between a nickel size and a quarter size. If you have a patient that's rather large and you're unable to palpate the PMI, you can ask your patient to sit up and raise this again so that I can get my hand there, and to lean forward. What that does is brings the heart forward so that you might be able to palpate the point of maximal impulse easier. The next step is auscultation, and you're going to use the diaphragm of the stethoscope, so the fat part of the stethoscope, to listen for normal heart sounds. So in auscultating, you're going to auscultate at each heart valve: the aortic, pulmonic, tricuspid, and mitral. A mnemonic to remember these valves is A, pet, monkey. A is for the aortic, P is pulmonic, T is tricuspid, and M is mitral. You're going to make sure that you auscultate with the diaphragm of the stethoscope over each valve. It's very important that you are listening for a period of time where you're actually trying to distinguish S1 and S2. So listen to the aortic, then I'll come over here and listen to the pulmonic. Again, keeping the stethoscope on the skin with preserving all modesty, you can still listen to the tricuspid. And then listen to the mitral. Having female patients tends to make students a bit nervous, but try to preserve modesty that you can. Ask your patient to help you. If someone has a larger breast, you can ask them to lift it up for you so that you can get to the valves that you need to and hear correctly. When listening to the heart valves, you're trying to distinguish S1 from S2. S1 is the closing of the ventricles, so it's the mitral and the tricuspid, and then S2 is the closing of the aortic and the pulmonic. When listening, if you want to try to distinguish which is S1 and S2, you should listen in the mitral area for S1 and palpate the carotid. S1 should correlate with the carotid pulse. S1 is going to be louder in the apex of the heart, which is the mitral and the tricuspid, and then S2 is going to be louder at the base of the heart, which is corresponding to the aortic and pulmonic. If you ask the patient to take a deep breath, you can sometimes be able to get a better split on the S2. When moving forward with the advanced cardiac exam, make sure to ask your patient to lie on their left side when you're auscultating for abnormal heart sounds, including S3 and S4. S3 is going to follow S2, and S4 is going to be right before S1. When you're listening for S3 and S4, you should listen with the bell of the stethoscope. So again, you have to switch your stethoscope around and make sure that you have it correctly placed on the bell. You're going to listen to each valve once again. The aortic, the pulmonic, the tricuspid, and the mitral. When you're listening for heart murmurs, you're going to listen with both the diaphragm and the bell of the stethoscope. When listening for high-pitched murmurs, you're going to use the diaphragm, and when you're listening for low-pitched murmurs, you're going to use the bell. So you're going to go through each valve listening with both the diaphragm and the bell. Then you're going to switch it over to the bell, and you're going to listen for low pitch murmurs. The next step that we're going to do is to listen for bruits in the abdomen. You're going to listen to the abdominal aorta for a bruit, your iliac arteries, and your femoral arteries. For listening for bruits, you're always going to use the bell of the diaphragm. The abdominal aorta is located about 2 centimeters above the umbilicus. And make sure that you have your bell on. And again, you're going to be listening for a swooshing sound, which would be positive for a bruit. So that's the abdominal aorta. Then you're going to move laterally to the umbilicus. The aorta comes down and bifurcates into the iliac arteries. So you're going to move down on either side of the umbilicus, listening to the iliac arteries. Listening to the iliac arteries. Then you're going to move down to palpate the femoral artery and to auscultate for a bruit of the femoral artery. It's real important here that you get your patient to assist you in raising the waistband so that you can palpate and then move your stethoscope onto where your fingers are palpating the artery properly. So if I can get you to lift up, and then you want to explain to your patient what you're doing, that you're going to be palpating for a femoral artery. Once you locate it, you want to then slide your stethoscope right over and listen for a bruit. You're going to want to do the same thing on the other side. Palpate it. Move your stethoscope right over it. And listen for a bruit. It would not be acceptable to do this maneuver if you don't have the patient helping you. If you're palpating, to then remove your hand, get your stethoscope, and then put it in there, because you've lost your location of your artery. So it's real important that you have the patient assist you. Or if you're able to do it where you can lift the waistband, you can palpate with these 2 fingers, and then just slide, much like this if you're palpating, and then just slide your stethoscope over it. But if you are removing your hand and then placing the stethoscope on there, you've lost the location of your artery. Part of the advanced cardiac exam is going to include inspection of the upper and lower extremities. When you're inspecting the extremities, you're going to be looking at hair distribution, color of the nail beds. You're looking to see if there's any cyanosis, which would indicate poor oxygenation to that area. You're looking, you're going to be feeling for the temperature of the skin. Is it warm? Is it well perfused? And so make sure that when you are inspecting the patient's extremities that you're explaining to them what it is that you're looking for. After you have inspected both the upper and lower extremities, you are then going to want to check pulses. So again, you're going to check brachial pulses, which are located again medially to the antecubital fossa. And you're going to check radial pulses. sure they're simultaneous. Going to the lower extremities, dorsalis pedis, which are located on the top part of the foot. And then posterior tibial, which are located behind the medial malleolus. T, tricuspid, and M, monkey.
It's the monkey valve.